Radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212 Choices, 212 Choices for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hi, we're back and happy to be speaking with you. I'm glad you could tune in tonight. I have a patient that I want to speak to you about, a 44-year-old woman. She's a lawyer. She has 2 children. She just came to me this week. In 2002, she had an abnormal pap smear. It was a grade 3 dysplasia. She was treated with conization, so it was not cancer, but it'd be considered pre-cancer. And she had follow-up, and then in 2007, she moved to another state, and from 2007 to 2013 had no insurance and had no care. In 2013, she had vaginal bleeding and spotting and was seen by her gynecologist and was diagnosed with cervix cancer. Now, not too many women are getting cervix cancer nowadays thanks to the pap smear. Pap smear is a great way to detect abnormal tissues and changes early before they become cancerous. So if you are a woman and you haven't had your pap smear, please get your pap smear. This case should be a lesson to us all. Anyway, she missed about 6 years of pap smears. She presented in 2013 with vaginal bleeding and had an invasive squamous cancer. At that time, the cancer hadn't traveled, and just about a year ago, she had her uterus removed. They left the ovaries in, and at that time, there were 3 positive pelvic lymph nodes. And she, rather than taking traditional therapy, started on vitamin C drip and mistletoe. And if you want to look up mistletoe, you can look it up. It's a parasitic plant that grows around the world, and apparently a lot of people are taking it. There's no studies showing benefit. So if you think that's your easy ticket to success, there are no studies, randomized studies, showing benefits in human beings. Yeah, there's some studies in mice and cockroaches, but human beings are different. You have to get a dose that is tolerable, and you have to have a dose that's effective. And when that is done, there is no benefit to mistletoe. And the same is true for vitamin C drip. Well, she unfortunately relied on mistletoe and vitamin C drip, and sadly has had progression of her cancer by PET scan. So She has one tumor in the left pelvis that's 2 centimeters, and another one that's 2 by 1 by 1, another one's 2 by 2. She has very few symptoms. She's in great shape otherwise, and she came to us this week for radiosurgery of these 2 tumors, even though she's been getting mistletoe and vitamin C. So she's hitting effective therapy. What's interesting is she provided me the notes from her doctor. She went to a doctor at a big cancer center in Texas, and he wrote this 3-page note saying that there's no way radiosurgery would work on a 2-centimeter lesion. We've treated 20,000 tumors like this, and our success rate's 90%. So it's another story of where you go, you may not get information that is useful to you. Just like the study I provided just a few minutes ago. If you go to one hospital, you get the big operation with a big incision. You go to another hospital and you get another operation. You come to us and maybe you won't get any operation. It depends where you go and the expertise of the doctor. It makes such a difference. So we're talking to her about getting effective therapy to try to cure her. Unfortunately, she's missed a lot of time, these 6 years where she had no insurance and didn't follow up. And then after the surgery, when she was found to have 3 lymph nodes positive, she had vitamin C drip and mistletoe. It did not work. The cancer progressed, and she's now here with us, and we're trying to convince her. And in fact, she started radiosurgery so we can hopefully obliterate these 2 masses in her pelvis, and hopefully she'll accept the rest of the therapy, potentially curative therapy. She's a great woman. She's 44. She has 2 little children, everything to live for, and we are doing everything we can to try to make potentially curative therapy work in her. That's what we want, and we hope that's what she wants, and I've provided her a lot of information and data about our work. From the good news department, we had a man who came with stage 4 prostate cancer. Now, I know a lot of men think, I don't want to know about prostate cancer. I'm feeling great. I just don't want to know about it. Well, this man felt that way too, yet he presented with metastatic prostate cancer. He's a young man, about 55, and not only did he have painful metastasis, but the cancer had grown so big in the prostate that he had to walk around with a catheter for 4 months. That's when he came to us. We treated the metastasis in the bone, which was causing him so much pain. The pain went away. We treated the prostate and got the catheter out. He's urinating fine. He's feeling fine. He said actually he's never felt this good. So it's a good news department where you can take someone in pain, unable to urinate, and get the pain gone and get the urination going and get the prostate shrunken. And another good news department, we had a man about 90 years old. He came in from Staten Island every day, had a squamous cancer over much of his left face, from the eye all the way covering the ear. He was going to go to one of the big hospitals in Manhattan for surgery. They're going to remove half of his face, if you can believe that. He's 90 years old. The surgeon proposed that, and when the patient got to the hospital, someone in the hospital nixed it. Thank God they nixed it. I treated this man 20 years ago for prostate cancer. He's still in remission with our prostate brachytherapy program. He's still in remission 20 years later. He remembered to call Dr. Lederman. He did that. We started treatment. He's half done with the treatment, and most all the cancer is gone. He's got his face, he's got his ear, he's got his skin. He's happy, he's motivated, he's 90 years old. He comes in every day from Staten Island to Manhattan. It's not the easiest commute, but it's worth it if you can save your face, literally. And that's what seems to be happening. The cancer's melting away. He is doing great. He is happy, and happiness is contagious. And we had another woman come in this week from upstate New York, a 67-year-old woman, married. She came in with her husband. She has 2 children. She has a golf ball-sized mass in the right breast. She's had no mammogram. She's had no evaluation. She feels something in the axilla. She came in late in the day, and nevertheless, we were able to get her arranged, even though she came in after 3:30. We were able to get evaluation of her, a biopsy of this mass, even though it hasn't been done for years. She's never had a mammogram. And we were able to do this all in a half hour. So the beautiful thing for her is she was able to come in and get answers. We did cancer markers like CA15-3 and CEA, so she knows how to follow this. We got other blood tests, and then she'll be back next week, and we'll sit down and talk about all the options for her based on her request when she wants to come in, but she'll finally have the answers. And by the way, I know a lot of people are afraid of biopsies, that they're afraid of pain, or no, we can numb up the skin, put a little needle in, take out the cells, make a diagnosis most commonly, and give you that information painlessly. So if you or a loved one have a lump that's not diagnosed, that's not getting better, it's time to stop waiting and find out what's going on. It's not going to get better by itself, especially if it's cancer. Wishing it is not going to make it go away. So please, and we've had so many people this year with lumps and bumps and growing masses that people were just afraid to come in and get seen by their doctor or surgeon. Just because you have a lump doesn't mean you need to have surgery. But you should get diagnosed to get proper care and learn the options. This woman has a daughter, so she'd obviously want to be able to tell the daughter if you have breast cancer in the family. And if you have breast cancer and find it when it's localized, the cure rate's very high. For T1 breast cancer, the 5-year success rate is, cancer-free success rate's 95%. So there's great success, and of course we wish this woman well, and she'll have all the answers. There's an article that was just published in the journal called Radiology that showed that mammographically detected breast cancer is associated to earlier stages, even in older women. So mammograms find breast cancers before the woman would find the breast cancer herself. This is an article by Melgren. It was published by the Astro Post and also was appearing in the scientific journal called Radiology. Now, the American Cancer Society recommends annual mammograms for women over the age of 75 as long as they're in good health, and that makes sense because a woman over 75 most likely is going to live another 15, 20 years. She's more likely to hit 100 than probably the rest of us. So there's a good reason that medical care should be provided to all patients, all ages, based upon common sense and not laws handed down by XYZ. So mammographically detected breast cancers in women more than 75 years of age who are more often early stage, where a physician found and patient detected cancers were more likely to be advanced. So it should give you the motivation to get a mammogram. Mammograms are easy and safe. They're a lot different than they were 20 years ago. If you've been avoiding your mammogram for the last 20 years, like this woman who never had a mammogram in her 67 years. And furthermore, mammographically detected breast cancers more often detected and treated with lumpectomy and radiation, fewer mastectomies. And we know that lumpectomy and radiation gives at least equal, and there's quite a few studies showing even better results, which means better cancer-free survival, less death. The 5-year disease-free survival was 97% for mammographically detected invasive cancers. 97%. So it should give a wake-up call to all. Please get your mammograms. If you have a question about it, please give us a call. Better yet is to come in. We can sit down and talk about it. Talking is the basis of forming a relationship and understanding us about you and you about us and the medical world and all the options that are available to you. So we do believe you have choices, and that's why our phone number, by the way, is 212-CHOICES, 212-CHOICES, which is 212-246-4237. You can call us for information. We have a free booklet DVD, and best is to call to make an appointment to sit down and talk about all of the issues that are of concern to you. This is Dr. Lederman. We're going to hear from our sponsor, and we'll be right back to talk more.
Here's Dr. Gil Lederman.